Carter and 7 First Alert meteorologist Autumn Lewandowski.
Welcome back. I am joined at this hour now by Cambria Daniels. She works in the Building Brighter Futures program in our Buffalo schools. And Brittany Palermo, you work as a program director with Best Self as well. So we're talking this afternoon about Suicide Prevention Month, especially as it relates to some of our youth. And a mother reached out to me during some of our back to school coverage. And she said, you know, Madison, back to school is not an exciting time for all parents, for all students. Sometimes it's really scary. Kids have anxiety and parents have anxiety because of some of what goes on. So talk to me about, you mentioned there are some barriers to entry when it comes to going back to school?
Absolutely. So some of our kids, you know, they are actually stressed coming back to school because absolutely necessary, but there are shelter-in-place lockdown drills. Some of the schools even they pass through metal detectors. You know, school's supposed to be a safe place, and what happens is the kids do not identify. They don't understand that, well, why do I have to, you know, hide in a classroom, turn off the lights, and so on. So some of the kids, and even bullying, you know, they're not looking forward to school.
And that it wasn't like that necessarily when we were growing up. I know I had tornado drills.
Exactly.
But today it's changed.
Yes, significantly, right. So yeah, you'll see the kids that are withdrawing, you know, they're fighting you, they don't want to come to school. Maybe they're seeing a kid that, you know, is triggering them, you know, paying attention to those signs because, again, children should be happy to come to school and they're not.
Right. And so, Brittany, what are some of the signs, the triggers? Is bullying playing a role? Are there other things? What are we looking for?
Sure. So when you think about risk of suicide for young people, we would be looking for things like changes in routine, so changes in their eating habits, their hygiene. Also verbal threats of suicide or self-harm. So when a child actually says, I don't want to be around anymore, or you know, it won't matter because I won't be here much longer.
What do you do though? Because we've all maybe been in a situation where we've seen someone, we might have some concerns, but what's an accessible way to actually reach that person if you feel like they're in danger?
One of the best things you can do when you're concerned about somebody is simply ask. Very straightforward. Are you thinking about hurting yourself? Are you thinking about suicide?
And if they say yes?
One of the best things you can do if they say yes is connect them with help. So calling Spectrum Cares, calling crisis services, connecting them to a counselor. Those are all good options.
And then, Cambria, you work in some of the schools, and so you're actually physically there. Do the kids actually come to access help from you, or are there stigmas attached to that? Are they saying, we don't want to be seen going into that office?
Oh, absolutely. So I love that Brittany brought it up. You know, there's the referral number one. So we serve as part of the student support team. So your school psychologist, your school social worker, they contract Best Self into the schools. We're in several Buffalo public schools right now because they realize they have that need. So yes, unfortunately, there is still a stigma around mental health. However, it starts with the relationship. You know, you build that relationship with the youth, you know, letting them know that they can trust you, letting them know that we are here for you, and educating that family so that they're more likely to obviously sign off on consents and such.
And do you reach out to parents? Do parents reach out to you? Is that how they get in contact?
Absolutely. So a parent can refer, you know, if they come through the door. The issue is, are they coming through the door? You know, sometimes, unfortunately, the kid, you know, might be suspended, or there's some sort of behavioral report that causes the kid to be out of school suspended, and there's the conversation saying, hey, well, your kid did X, Y, and Z. Now we have to have a different type of conversation because we want academics to succeed.
And then lastly, a question for either of you, for students, for parents, how do you tell your young person if you see someone maybe in your class, if you're younger, how do you reach out to that person that might need some help? Do you tell an adult?
Absolutely tell an adult. I think I, again, would encourage anyone who's concerned about a peer or a classmate to simply ask, are you okay? Is everything all right? Do you need someone to talk to? But absolutely connecting to a trusted adult is always a good idea.
Okay. All right. Brittany Palermo with Best Self as a program director, Cambria Daniels with the Building Brighter Futures program, both joining us today. We're going to post a link to those resources, how to reach out to them on our website. But for now, we're going to send things over to Autumn Lewandowski. She is